Hello, my name is Jessica, and I'm a licensed practical nurse. I have been working in the healthcare field for the last 10 years, and at this time, I'm currently continuing my education in nursing. Today, I'm going to talk to you about how to properly monitor your blood pressure, the benefits of monitoring your blood pressure, and how to properly take your blood pressure. Have you ever known how to monitor your blood pressure? Have you ever thought about monitoring your blood pressure regularly to notice a pattern? I will also give you some different devices that you can use to monitor your blood pressure, such as a manual cuff or an electric cuff. We all know someone who suffers from high blood pressure, and they may be on medications to control it. I'm going to let you know what high blood pressure is. High blood pressure is also known as hypertension, per the American Red Cross. Hypertension is defined as when the force of your blood pushing against the walls of your blood vessels is too high, which can lead to other serious problems such as a heart attack or a stroke, per the American Red Cross. Hypertension affects all age groups, even if you seem healthy. Being a nurse, I have seen a lot of different age groups suffer from high blood pressure, either hereditary or self-induced by the diet they consume. I have taught a lot of patients healthy food choices, and you will be surprised as to what people think are healthy foods. Monitoring your blood pressure is important and only takes a few minutes out of your day to do. Monitoring your blood pressure is non-invasive, which means it doesn't require any procedure or prep to do it other than waiting the 5 to 30 minutes before. You can keep a blood pressure journal by writing your readings down for 2 weeks and looking for trends. When purchasing a blood pressure cuff device, you want to purchase a manual cuff or an electric cuff, but you want to make sure it fits properly by making sure you can fit 2 fingers in between the skin and the cuff. You want to sit in a chair with your back supported and feet flat on the floor. If you have been doing any activities, you want to wait at least the 5 minutes. And if you've been smoking, drinking caffeinated drinks, or exercising, you want to wait the 30 minutes, as I've said before taking your blood pressure. And to do that, you want to prevent any false readings. You want to take your blood pressure at the same time every day. And if you can avoid it, do not put the cuff over your clothes. Now that we have talked about the importance of monitoring your blood pressure, what hypertension is, and how to properly take the blood pressure, I want to talk to you now about what the readings are. A normal blood pressure reads between 120 and over 80. Hypertension stage 1 reads 130 to 139 or 80 to 89. Hypertension stage 2 reads 140 or higher or 90 or higher. Which, if your ranges are in hypertension stage 1 or 2, you may want to consult with your physician if you feel concerned. Now we'll give you some examples of how to prevent hypertension. You should reduce your salt intake, eat healthy foods, avoid or limit alcohol intake, don't smoke or use tobacco products, keep a healthy weight, be physically active, and exercise regularly and get good sleep. Now I'm going to give you an example of how to properly place the blood pressure cuff. Okay, so now I'm going to show you how to place the blood pressure cuff properly. You want to slip the arm through. You want to tighten the cuff with the bell part facing inward. You want to get your stethoscope. You want to place the bell part of the stethoscope against the skin towards the inner artery. You're going to tighten the bulb, pump the bulb up, and you're going to listen for the first beep. The blood pressure cuff will deflate itself and you'll hear the sounds. Okay, her blood pressure was 120 over 60. And that is the manual cuff. Now I'm going to show you how to use the electric device. You're going to place the computer part of the electric device. It's a cuff. You're going to cuff it around the wrist with the electric part on the wrist. You're going to push start, and they're going to place their hand over their heart. The computer is going to pump itself up. Once it stops, it will give you the blood pressure reading. Now that we have talked about how to properly monitor your blood pressure, the benefits of monitoring your blood pressure, and how to properly take your blood pressure, we all can focus on preventing hypertension.